Good afternoon and welcome to Generous Futures, Addressing Ageism. My name is Michael Nyson. I'm the Executive Director of the National Institute on Aging at our university. We are very excited about this panel today and we can't wait to dive into discussion. Before we begin, I'd like to acknowledge that Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. I'm delighted to be moderating the first panel in a season 2 of the Generous Futures series. Generous Futures brings the diverse identities, experiences, and perspectives of the philanthropic community to the forefront. Season 2 will explore ageism, Islamophobia, anti-Asian racism, and disability rights. We hope you'll join us for the rest of the series coming up this year. Before we begin the discussion, I'd like to thank our lead sponsor for the series, TD Bank Group, for helping to advance these important discussions. TD Bank Group has been a great supporter of our university, and we are delighted that they have joined us today on this journey of understanding. Today, we're focusing on ageism. We'll tackle questions like, how does Canadian society discriminate against individuals based on their age? How can we ensure that seniors are given the respect, dignity, and agency that they are entitled to? And what role does philanthropy play in better supporting our aging populations? Our panel will explore these questions and shed light on how charitable giving is carving new pathways for and with seniors. I'll pose some questions to the panel, but following this, in time permitting, we'll ask the panelists some questions that came from the audience submitted by you when you registered for the event. And now I'm delighted to introduce you to our panel of leaders. First up is Dr. Samir Sinha. Dr. Sinha is the Director of Geriatrics at Sinai Health System and the University Health Network in Toronto. He is also Professor of Medicine at the University of Toronto and the co-founder and Director of Health Policy Research at the National Institute on Aging. A Rhodes Scholar, Samir is a highly regarded clinician and an international expert in the care of older adults. He was recently appointed to serve as a member of the Government of Canada's National Seniors Council and is also leading the development of a new national long-term care standards for Canada. Welcome, Samir. Next up is Mitch Frazier. Mitch is a partner and the chair of the Pensions and Employment Practice at Torys LLP and the Chancellor of Ontario Tech University. He is the co-founder and chair of the National Institute on Aging, a former adjunct professor at both the University of Toronto Faculty of Law and Osgoode Hall Law School, a senior advisor to the Dean of the Ted Rogers School of Management. Mitch has also held a number of volunteer leadership roles in our community, including serving as the immediate past chair of our Board of Governors. He is also a recipient of an honorary Doctor of Laws from our universities. Welcome, Mitch. Chamelli Narain is president and CEO of SimCorp and is also the founder of the Narain Global Fund. As a generous supporter of the National Institute on Aging, Chamelli notes, quote, recent health, climate, and public policy decisions are having a disparate and adverse impact globally, particularly among women, the poor, and older adults. The fund also supports grassroots initiatives to advance results-based solutions with a particular emphasis on promoting health, education, and wellness among women and girls of all ages. Welcome, Chamelli. And last but certainly not least, we have Dolores Lawrence. Dolores is the founder, president, and CEO of NHI Nursing and Home Anchors, Inc., an award-winning Canadian healthcare company that offers healthcare staffing and home care services to clients in hospitals, long-term care facilities, insurance companies, dentists, and other healthcare companies. As a philanthropist, Dolores has a passion for helping those in need. In recognition of her leadership and charitable work, Dolores received the Order of Ontario from the Province of Ontario, the Order of Distinction from the Government of Jamaica, Vice Chancellor's Award from the University of West Indies, and the Order of the Diocese of Toronto from the Anglican Church. Welcome, Dolores. And welcome to all of you. What an amazing panel we have today. I think those bios give you a little sense of what we have in store and what we'll hear. But let's dig into it. I'd like to start by asking some questions, the same for all of you to begin with. But let's start with you, Samir, and then maybe we'll go to Mitch, Chamelli, and Dolores. That first question, of course, is what is your first memory of generosity and how do your memories influence your perspective on this topic? Please go ahead, Samir.
Thanks, Michael. Yeah, and this is a tough question because I think you can think of generosity in so many different ways to think about just people being kind and helpful to each other and to you as well. But I just remember that one of the things that probably unites many people who grew up in Canada as children was wearing these, going out trick-or-treating and then being given one of those orange UNICEF boxes to carry around, because I was on the hunt for candy, but I was told to also collect this money. And I'm like, and I never kept the money. But, we weren't necessarily always explained kind of what that was all about. And of course, it prompted me to ask my parents questions, and my teachers questions, like, what, who gets this money? What are we doing with this money? What's it all about? And it really reminded me that really you're collecting pennies, but those pennies from thousands and thousands, millions of people can actually have significant change in an entire other part of the world. And it started getting me thinking about, kind of generosity, that really, just a penny, when you bring it all together, can make an incredible change. And it always kind of sat with me that no act of generosity is too small, because when you actually bring it all together, it can make a significant difference. And that's always reminded me now that as I'm, actively seeking funds for the work that I do and in the work that I support, it's never look a small gift, aside, because every gift matters and every gift, makes a difference.
Excellent. Thank you very much. I think that's a wonderful metaphor that just a penny added up goes a long way. Mitch, let's turn to you.
Thanks very much, Michael. I'm going to follow a bit on Samir's coattails there in terms of that. My first memory of generosity and fundraising and giving back to the community is actually from my mother. She and one of our neighbors would go door to door and collect money for the Kidney Foundation. And I didn't quite really understand when I was a little kid, I must have been 3 or 4 years old, like what they were doing. She'd go out, she'd be out for a few hours, and they'd go, door to door. And my mom, is, very much a role model for me and someone, I've very close to all throughout my life, and even this day. And often talk about volunteerism and I have the privilege of being involved with a number of activities, and she'll say to me, like, why do you get involved in all these things? And I'll say to her, like, I remember seeing you as a kid doing that, and I didn't really understand at the time, like, how you going door to door and collecting money for an organization could change the lives of so many. I mean, as Samir said, it's no donation is too small. We're all here to take part in the collective good. Never think that you can't, make a difference. I know it always sounds hokey, one person can make it. It's really true. One person can, but one person is part of the collective, because if you go out and do something, you can get one of your friends to go do that, and they can get a friend, and it really builds, from there. So it's, whether it's organized act of kindness or random acts of kindness, whether it's, buying a coffee for the person behind you in the coffee line, all these things just make people feel better and make people's days and can inspire people in many ways. So I won't go on any longer on that, but it really is goodness begets goodness, and we can all do our part in making the world a better place.
Yeah, that's good. Thank you, Mitch. Chimeli, can we come to you next?
Yeah, thanks, Michael. Well, just to follow along, I think, I've been lucky in many ways to have many exposures, I think, of generosity, albeit small at times, but it's a cumulative effect that I think has really had an influence on me. I go back to my grandparents who were farmers in Essequibo and saw what they did in their village to help people with food and support, to my mother, who was been fairly active in the Waterloo community, contributing, to even on a professional sense, mentors that has helped me develop my career and show me the way. So, those were all small acts of kindness and generosity that became sort of the cornerstone and influenced my thinking as I sort of grew into this role. And so now where I sit in this is it's foundational, and it's helped me develop my thoughts and, ground me in commitment and action and accountability to make a difference wherever I could, whether that was being a big sister for a decade with little people, to getting involved with you guys at the NIA when the crisis hit and COVID was like, wow, this is a really call to action, and it's time to step up and be accountable as as a human and act in a generous way with a lens of caring towards it. So for me, it's real.
Excellent. Yeah, I couldn't agree more. And as a recipient of your generosity, I think it illustrates really well what you just recounted there from your growing up. Dolores.
Oh, Dolores, we have you on mute.
Thank you. Thank you, Michael. This brings up so much memories to me because I'm of a Jamaican background, and my mother was very active in the community in general. And my father was in England at the time. And so my mom became the treasurer of one of the charitable foundations. That was a very big deal at the time. And we provided I was about 8 years old. And one of the mandate was to provide food and clothing to the poor. And for those that are in the community that had died and did not have anyone to bury them, that the organization that she belonged to provided a dignified burial to the poor people. And so throughout my whole life, whether it be the charitable organization or political involvement, I have seen that. And so when I migrated to Canada at the age of 17, that continued for my high school and throughout college, university. That kind of a charitable form that I've seen from my mom and from my dad. And as I got older and became an adult, got involved in anything in the community that was that provided some kind of leadership. I'm there, and I'm there to help, and also writing the check. And it always made me feel good when I was writing the check. I felt like I was giving back because I felt that I was blessed to have, and it was my role to be able to give back some of what I got. So I enjoy the whole philanthropy area.
That's excellent. Thank you all for your answers. If I could sum it up, I think what I heard is small acts add up. Generosity starts locally, and I think it also expands across the generations. We all invoked parents, grandparents, siblings, and I think that's actually a nice pivot to the next question, where we're going to start talking a little bit about ageism, the aging population, and how generosity could have an impact there. We'll start with you, Samir. You're a highly regarded clinician, international expert in the care of older adults. In your view, how does Canadian society discriminate against individuals based on their age, and what can Canada learn from its global counterparts?
Yeah, so ageism is one of these things that cuts in a number of different ways. It's one of these things that we by and large as a society, thankfully, realize that sexism, racism, that these things are just not acceptable. It still happens, let's be clear, that still happens. But I think as a society, collectively, we know that these things are not acceptable, but somehow ageism is that last ism that somehow just still seems to be acceptable, and it pervades everything that we do, from a societal belief that we need to stay young and we're youth obsessed. But then you start thinking about ageism, and we think about it discriminating against older people, but also you can also note that there's ageism against younger people, saying you're too young, you don't have enough experience, and but ageism by and large is something where we see a discounting of older people and not necessarily valuing what they can bring to the table, very much so, and how that really can negatively influence our ability to kind of grow as a society. And when I look, when I even just look within Canada's borders, for example, you can just look to our Indigenous communities, which have an incredible, profound relationship and a holistic respect when it comes to respecting older people. And even the idea that just being an older person in an Indigenous community does not give you the right to be known as an elder. An elder is even a much more prestigious kind of role that one can potentially aspire, to have. But it was amazing to see that during this pandemic response, for example, when a number of communities were rallying to develop their own COVID responses that were frankly stronger than what we were seeing in the rest of Canada, when chiefs of communities were being asked, what's motivating you? And they said, we need to protect our elders. They are our most valuable resource. You lose an elder, you lose a library, you lose a tree, like a tree of knowledge. And it just gave me goosebumps because I was watching how, in general, we weren't doing well enough to protect our most vulnerable older adults. And the rest of Canada as well. But I think when you look at other countries, people often say, well, maybe, we're Western society, Eastern societies are better at caring for older adults. And yeah, in general, there is a lot more of this notion about respecting and supporting older populations. But we have to realize that there is a value proposition to doing this. Again, as Indigenous communities note that protecting an elder is actually a way to preserve knowledge, experience, things that can actually pay dividends to younger generations. I feel that we need to kind of start realizing that by us moving into a non-ageist platform or format, we can actually do even better or grow even more as a society when you think about the opportunities that an age-friendly or society can actually bring.
Yeah, thank you very much. And actually, you and Mitch are both co-founders of the National Institute on Aging. Mitch, I'll ask you this though. You co-founded the National Institute on Aging. What was your impetus for doing so? And can you tell us a little bit about how the NIA is breaking down the barriers and pushing for positive change on aging in Canada?
Absolutely. Thanks very much. The impetus for National Institute on Aging, I guess, really started off with the focus of my law practice, which was very much aging from a financial perspective. So it's making sure that people save money, whether through pensions or other various, type of savings methods, mirrored with what Samir's doing, which is making sure that people age in a healthy way, making sure their health is good. And the problem really is that you really can't have one without the other. You can't have a lot of money and be in poor physical and mental condition and have a really good life or say the second half of life. Similarly, you can be really, really healthy, but have not planned economically and then really can't live, I wouldn't even say retirement, I would say, your most important years, properly. And so, Samir and I, and then you and others got into, building this institution to make not just people, but, governments and companies and other organizations realize how important the whole process and the whole life cycle of aging is. And what the NI has really done is, I think more so than anything else, is make people think. When we started this, important organization several years ago, I don't think there was a federal minister of seniors. There certainly wasn't a provincial minister. There was a provincial minister of seniors, but it wasn't really high priority. And we can see now how seniors, long-term care, the Ministry of Finance and both federally and provincially across the country have focused, on the need and the importance of seniors, the importance of aging, the importance of healthy aging. And so, what this organization has done has really brought this to the forefront of discussion. As Samir said earlier, there's a lot of isms that we've sort of broken down, and the last frontier, as far as I think we're concerned, is ageism, and not necessarily even from a senior's perspective, but for valuing people at all stages of their life and looking at this as a holistic life cycle. And so the NIA really is trying to I think it's done a great job of putting this on the radar across the country. But we're here to keep it there, and we want to get anyone who understands how important this issue is, working together, to really make a difference, across our great country.
Excellent. And actually, in fact, Kameli, you and I had the pleasure and my privilege of meeting at the start of the pandemic. when opportunity, crisis, and I think your generosity certainly collided to support the NIA through some of the important work Samir was certainly leading on long-term care. Can you please tell us more about the incredible work of the Narain Global Fund, what it's doing, and how you were compelled to support issues of aging and of our aging population?
Yeah, thanks, Michael. Well, if you just go back a little bit, I think our foundation is about 15 years old in its in its stage, and I think we started out and still are taking the long view on this, and it's really the core for us is lend a hand where we can. And we've done work in India, whether it's mobile libraries, education, literacy. We've done work in Honduras, still very active in Honduras with building girls' schools, education facilities, healthcare, those types of things that we're working in the villages with, not alone, but certainly with folks from the US and Germany and so on, but we're trying to make a difference there. So where we are, we're sort of more grassroots involved in that, but we have now started to look differently at the sort of the big issues that we're facing and trying to figure out how we make a difference, like climate change, like aging, and in general, the health of elderly people. How do we make a difference at a grassroots level, still keeping that sort of core to who we are? Food security is something we're big on. We've been doing work with Trent University for the last 3 years, trying to figure out the types of food that we can grow in the Canadian region of Peterborough. And I think we've been very successful in looking at that, being ready for climate change. But where we are now, I would say, Michael, COVID, if nothing else, has been a loud wake-up call in the reality of what we can and can't control and how we need to be better prepared. What was very stark to us was what's happened was very tragic, I think, in the globe, but certainly in Canada. It was tragic what happened to our elderly, and what happened in the long-term care environment in this country was quite sad. And it was almost like listening to Dr. Sinha sometimes, or yourself, about, wow, these guys are really calling it out, calling the issue out, addressing it, at least making the community and the citizens aware of what's happening in the aging community. And so we sat down in our foundation and said, look, we've got to get on this, right? This is something near and dear. We're certainly getting older. Whether it's my grandparents, whether it is my mother getting older, who's drilled into my head that I must stay in my home and I want all the services. She's 87 and full of energy. Just recently lost my aunt. And it's just the reality of whether we like it or not, I'm in this club and I've got to get to a better destination of aging. And I think it's real for us. So for our foundation has now embraced this. And I am very pleased to be a part of supporting the work you and Dr. Sinha is doing. And I think we just got to do a lot more, and I've got to help where I can through the foundation to give you guys a hand, whether it's new models, whether it's policy, whether it is doing pilots and trying to figure out how we conquer this. But I just know I want to be in a different destination as I age.
Absolutely, absolutely. And Dolores, we'll turn to you now. But as Chameli said, COVID was a loud wake-up call, and I think if we've learned a lot of things collectively over the past year and a half. But one of them is the importance of frontline healthcare workers. You've had a remarkable career in nursing. Tell us about what you've observed in terms of the issues seniors were facing when you started NHI Nursing and Homemakers Inc., and what's changed to remain the same.
Wow, I couldn't agree more that, Shamil, that what you said about COVID, it has really changed the face of healthcare. In the business that I started back in 1985, when we started that company, it was because as a registered nurse at the time and also working in administration, I noticed that when the elderly had surgery, they may have bowel surgery or knee or hip surgery, they would end up back in the emergency department of a hospital looking, they got constipated, there's no one there at home to help them, or they were readmitted to the hospital for simple things as managing constipation or just managing pain or just helping with personal care. And so the agencies, there were a few nursing agencies that were available, but home care was not home care as we know it now, where the local health integration network, which is called the LIN, participated in a great different way back then. It was, you had to have family, you had to depend on family to help you. And if you look at 36 years ago, those baby boomers were not at that stage where they were really helping the seniors in their homes. And so getting someone to help you with activities of daily living, including laundry or maybe just basic bathing and getting dressed or going out, it wasn't what it is today. And what I see that have changed, COVID have really brought a lot of families together in a good way, but somehow because of the ageism in an exploitive way, because there are families out there who do take advantage of that senior who may have financial resources that can help out. And so, you know, we see where the mom is now moving in with the daughter or the son-in-law, and, you know, her pension check or her annuity check is going towards helping to pay the mortgage or helping to pay other bills. And so that's changed a lot. The kids, a lot of people are working from home, and so they're able to keep an eye on what's going on with their elderly parent. A lot of the elderly parents, I find, they're living longer. People are living longer. I see that with, you know, people who are dying in their 80s, now they're in their 90s with medications galore that helps to keep them alive, I say. And so because of that longevity, family members are asked, they're reaching out now to the community care for respite because they've had enough up to the eyeballs with the family member who puts a lot of strain on them. And then things like Alzheimer's and dementia has set in. And so that again puts a lot of pressure on the family. So a lot has changed. And with COVID, I don't know where it's going to end, but I also see where a lot of families, they're not, they don't want their seniors to be in the long-term care facilities. They're bringing them home, and they're spending now a bit of those dollars that the seniors might have on their care at home rather than the long-term care, because so many have died in the long-term care facility, nursing home, and they just didn't want them there. And some of the seniors, they're a little bit more alert, and they can manage their own affairs with the help of a family member who may have power of attorney. So it continues to be fluid. Thank you.
Thank you. Thank you very much. Samir, I'd like to build a little bit on this, obviously the idea of generosity, but also philanthropy, and maybe a little bit in terms of what we've seen over the past couple of years. Certainly the National Institute on Aging has been a recipient. What role does philanthropy play in this space? What are some of the issues and opportunities from your experience that you've seen, whether it's at the NIA or in the hospital sector or your broader community involvement?
Yeah, it's interesting because when you look at, you know, let's go away from aging for 1 second here, just so I can give a comparison. When you look, for example, fundraising around cancer, we know that, there's a lot of great work that goes around fundraising to support those areas. But when you actually look at how fundraising occurs in that space, it's very disproportional. For example, the amount of funding that goes towards supporting breast cancer initiatives is massive. But the #1 cancer that kills older women is lung cancer, and it gets a tiny, tiny amount of funding because often people assert that, well, maybe that's related to smoking, maybe they deserved it, but it's a very important cancer as well, and there's a disproportionate response. So, I'm leading the largest geriatrics program in Canada at Sinai UHN, and outside my door is Sick Children's Hospital. And generally when you find, kind of where people will prioritize funding, people will be incredibly generous around fundraising around issues facing children, our youth, our future. But often when it comes to fundraising related to issues of aging, whether it's health related, whether it's policy, other work, it's often been kind of something that's not really a clear focus of many in the giving space. But that's been changing, and it's been great to see that changing now, because I think as donors, many people who are in the position to donate are getting older themselves, and people are realizing that aging, like climate change, like so many other things, are becoming major issues on the forefront. I think people are starting to now be curious about, well, where could I make the difference? Like Shameli was saying, like, where, this is important, this is real, and what can we do? And so when people come and speak to me, they say, well, where could I make a difference? I'm like, everywhere, frankly, because it's such a poorly funded area. But you can think about it, there's some aspects can be what I like to call venture philanthropy. It's maybe trying a new model of care out and seeing if it works, right? Because often there's not a lot of innovative work that's occurred in this setting. And sometimes you need a little bit of seed money to try something, see if it works, and then, be able to kind of move forward with that. But it comes from everything from supporting everything from public awareness, public education, education of healthcare professionals. I always remind people that out of 85,000 doctors, there's only 3,000 or 300 geriatricians in Canada. And just to give you context, there are more older people in Canada than younger people now, yet we have 9 times as many pediatricians as we do geriatricians. So it really shows there's a huge amount of capacity work to build more specialists from all sorts of walks of life in terms of aging, but also building infrastructure, programs, services, education. There's a lot of opportunities where philanthropy in this area can make a difference. But I also remind people, it's not even just the gift of finances, it can be the gift of time. We have a great volunteer program here called, at one of my hospitals, called MOVE, Maximizing Aging Using Volunteer Engagement, where people who might not be able to donate funding donate their time. They come and volunteer here and specifically work in programs working with frail older adults in the hospital to ease their stays. So there's many different ways in which people can be generous and focus in this area. But I can just say, if anybody's curious, you can make an enormous world of difference in an area that's often not received a lot of attention.
Thank you very much. Mitch, Samir, you talked a little bit about the perhaps neglected aspect of aging and philanthropy, certainly over time. You wear a lot of hats that get you across the intergenerations, whether it's as a pension lawyer or chair and chancellor of universities. Many employers are facing intergenerational challenges. What are your thoughts on how organizations could be more welcoming to older employees, and what are some of the issues and how you think we might be able to deal with them going forward?
Yeah, thanks, Michael. Great question. It always amazes me how older employees get put in a proverbial box. I think, and they often get tagged with the, how many more years are they going to be here? I don't want anyone to know my age because I think I'm going to get forced out. I'd like to go back to some basic tenets of President Obama, where it really comes down to, instead of no, we can't, yes, we can. And I think people need to look at this with a different lens. I mean, who are the most knowledgeable people in your organization? Probably your older employees. They've been there, they have more experience. Who are the ones that have the most compassion for others? Who are the ones that have the ability to understand other employees from different perspectives? Rather than looking at it from, how much longer do I have to be here? Are they going to be here? As how can I make the best use of older employees? And I look at it from, as you said, Michael, I have the privilege, and I would say I've been the chair of a board of a school that has kids aged 2 to 18. And I've been involved in universities that have people from age 18 to about 86. So I've seen the spectrum of aging. And I think, one of the things that organizations need to do is understand how to make the greatest value out of every part of organization. I think creating mentorships between older employees and younger employees. There'll be sometimes I hear, well, they can't work as hard. Well, maybe, but they can work smarter, and so I think rather than taking an older employee and saying, a 65-year-old is going to do the same thing as a 30-year-old. No, but different. Okay. And yes, we can. And how do we, increase the value of that employee? I mean, people are working a lot longer, and not necessarily because they need money. In some cases they do, but in some cases that, they feel they have more to contribute. And so organizations who don't treat their older employees properly, are really missing out, because they're missing the potential to get to a whole other level. As Samir said, there are now more older people than younger people in this country. We need to treat them well, and we need to take advantage of different skill sets, they believe, to make every organization better.
Excellent. Thank you very much. Shamalia, Mitch was talking about that spectrum, the age spectrum. I want to talk to you a little bit about how age and ageism intersects with other social issues. So how do you see the issue of ageism as it relates to, for example, gender and racial equity? What are some of the cultural nuisances that we should be thinking about as it relates to confronting ageism?
Yeah, thanks, Michael. If I could just go back a bit to build on Mitch's comment a little bit, having run a company through a pandemic, and I would say experience really, really mattered in business through COVID for the last 19 months. And it was actually the more senior and experience, and obviously added to age to that actually sort of got us a safe landing through this. So if there was ever a time to display the importance of age, experience, and wisdom, it was through this pandemic. Certainly from a business environment, that's been clear to me. But let me just come back and answer what were asking me. And so, yeah, I mean, I think, in general, as Samir said earlier, ageism is in many ways no different than the gender issues we have, racial issues we have. Is just on the list. I think for me, sometimes if I look at, again, this pandemic has brought a lot of things right to the forefront. When you look at the discrimination that is happening to immigrant women and access for immigrants in general, but access to healthcare is not the same, right? We do have an inequality in healthcare access, for example. Again, the pandemic has been harder in many ways on, from a working perspective, on women. They've paid the price in terms of having to stay at home and manage the kids and still keep a job going. And so it's been really harder. So we've got the ageism, the sexism, equal pay, equal work, those types of things at our doorfront. And part of it is inherent in where we are in this journey. I think things are getting better, but a lot of it too is just that unconscious bias, right? Like that's just really how we think about it. And ageism is no different. In many ways, personally, I look at this aging, I call it the aging factor for us, as it's not really kind of like a physics problem to solve. It's a biological reality of human dynamics. And I think the sooner we sort of wake up and get that, we can start to figure out how to build solutions for that. Much of the work you guys are doing. So for me, I would like to basically call out that racism is wrong. It's bad. We need to call people on it. We need to recognize that it's there, but not acceptable, and start moving towards a deliberate way of getting solution, right? We're not seek perfection here. Perfection is never the answer, but start building the right policies, the models, the where we live, how we live. Back to, in my mind, is that when I'm 61, so I'm happy to tell you my age, but I want to be able to land at my mom's age or older in a nice place that I say, this is a great destination. I've sort of earned it. It's nice to be, it's cool to be old, and it's just a natural thing as opposed to an unnatural situation, which we think we are looking at that now. So one more point I'll make on this, and that is the economic reality of Canada being a number 10 in the world's largest GDP nations on earth. We sort of didn't come out as bad as others, but we didn't come out as good as others through this pandemic. But I do think from an economic position, we need immigration to move the dial in GDP up, and we need the contribution of older people in our society to add, whether it is how they think, the experiences they bring to the table. We need that sector to help us drive a GDP growth in Canada. And I think we can. We just have to figure out how better to do it today.
Excellent. Thank you very much. Dolores, I want to turn to you, and you certainly know this as well as anyone coming out of the pandemic, but you know, some of the work that Samir and the NIA were doing last year showed, for example, that about 2/3 of all COVID deaths in Canada happened in long-term care settings. So, you know, with your experience there, I want to ask you, if some of these issues go unfunded, what does this future look like for seniors and nursing care? And then just as a little bit of an add-on, outside of fundraising and donating, how can people get involved and show they care?
That's a great question. I'm sure many of you might know that there is a shortage of nurses, shortage of PSWs in the healthcare system. And I would hate to see that the powers that be don't pay attention to this. A lot of PSWs and nurses, because of COVID, have left the profession. They've gone to do other things that are not healthcare related because many are scared of what has happened. But what is also happening is if things go unfunded, like right now, we have a lot of seniors who might just need someone for 2 hours or 1 hour just to come in and give them a bath or to help them with some basic activities of daily living. And a lot of the PSWs that are supposed to be in the system do not want to do that because you can't expect to send someone to someone's home for 1 hour when the TTC in Toronto costs $6 and they're getting minimum wage. So they have become more particular about how much they want. And you know, you hear it, oh, the Prime Minister promised us $25 an hour. Where is it? So there is that shortage that may continue for a while until more people are in the system. But at the same time, the facilities are asking for double vaccination, to which a lot of people still aren't participating and would prefer to be unemployed and don't know how they're going to live, but that's another part of the story. And so what you find is that unless family members step up to the plate and help, there's going to be a continued shortage of help that's out there for the seniors and providing nursing care or just basic help at home with home care. In terms of the fundraising, like the organizations, there are many organizations out there who are providing some kind of assistance for care that's unfunded through the regular scope of the Ministry of Long-Term Care. They are private organizations and funds coming through private donors. And so sometimes they're able to offer those caregivers or PSWs a little more. They can pay a little bit more than what the normal trend is, and to get them into help or to have what you call cluster care, where you may have a retirement home that have maybe 10 people that need care, and then you have 2 caregivers that would be divvying up between the 10 that needs the help. And so they end up with more or less full-time work. So it is a problem right now with PSWs and with nurses within the home care sector. And I'm hoping that that will be addressed soon, or it probably is on the table now being addressed, but they haven't figured out how to work that out just yet, unless you get more people trained. And nursing takes 4 years of training, RPNs take 2 years, and PSWs take 6 months, but a lot of places will not give the practicum for the clinical for them to get that, so that they'll be out there in the community. The other part of the question is, outside of the fundraising and donating, how can people get involved and show that they care? Well, through donating. There's seniors, younger seniors, helping older seniors, finding out in your community where help is needed. Some of this is through the churches or through community organization. And people can get involved by donating their time. and money too. That does help, goes a long way.
Excellent. Thank you very much. And thank you to all of our panelists for that excellent discussion. I think we hit on a lot of points there. With the remaining time, we have about 5 minutes or so. I'd like to get to a couple, at least, if we can, of the questions from the audience. So I'll actually pose the next one. There's a really good one here that I think gets to the rub of this whole discussion. I'll start with Dolores and Samir as our healthcare professionals. How does ageism impact the abuse that older adults may experience? Maybe Dolores, if you want to lead off.
Well, ageism, it's a problem. Like I find in our industry, you find like some seniors that are at home and they're being abused by their own children. And these are the children that have the power of attorney to look after them. And a lot of the seniors, you know, they get their pension checks and they get other monies that come from maybe annuities. And so there's a lot of abuse which is going on unreported within the community, within homes, amongst families. And that is something that I'm not sure how we get into people's homes and figure out if this one is being abused, but I certainly know from our experience, we've had to report abuse, verbal abuse and financial abuse to the organizations that ask us to provide services. And I think until that is reported and paid attention to, and remove the seniors from those abusive situations, they may end up in a long-term care facility outside of the families that are abusing them, then I think it will continue and it becomes like a family secret. Nobody knows.
And just building on that, I think part of the challenge is just that, again, you know, as a society, if we don't value, you know, older people collectively, then it makes those individuals more vulnerable. Like we all know that child abuse is just not acceptable, for example, and so it still unfortunately happens. But society is not willing to just kind of let that slide. Whereas again, somehow it's okay to discriminate against older people. It's somehow acceptable for older people to be abused or taken advantage of. And as Dolores was saying, most of the abuse that actually occurs in our society, it's not sexual or physical, it's more financial, it's emotional, it's even neglect. And somehow believing that that's acceptable it's partly at the root of it, but also recognizing that it's a complex issue. Sometimes people are inadvertently, they don't realize that the way that they're not providing support or care is actually a form of abuse. And sometimes they're just burnt out because they don't know how to access services that are available. So they're so overwhelmed that they end up being unknowingly neglectful in that way as well. So it just tells us that we need to do better, you know, to build those systems and supports in place, because when we don't create a society where older people and their families thrive, it then becomes a situation where these individuals who can be more vulnerable as they age, or especially if they develop cognitive issues like dementia, can be easy prey for others out there.
Thank you. And I think we have time for one more question from the audience, and I'll pose this to Mitch and Shimeli, both organizational leaders, as everyone is on this panel, but from your particular point of view in the private sector, what ways can you enact positive, inclusive change in your organization? I think, you know, if I'm transmuting what the reader, what the questioner is asking here is, what could they do within their organizations to really inculcate a sense of inclusivity and age positivity?
Please go ahead.
Yeah, Mitch, I'll go.
Yeah, then I'll go after you.
Yeah, so you know, I think for us, if I think about the private sector, if I think about my company, I think we, from a cultural perspective, we track and measure a lot of things. We look at how all our employees are doing well. We have a philosophy of employees first. Certainly through this pandemic, we demonstrated that. And I think we have to ensure that, and I think we do a reasonable job within our company, that we ensure that all contribution is happening the way it should be happening. So I bring this to the table. I have this experience, I have this skill, I know this job, I can train someone on this, I can learn something different. So when we look at the job types, you know, we got roughly 2,000 people in our company. When we look at the job types and we look at the dynamics, we actually have an aging population we have quite a sizable workforce that's over 50 that actually sourced originally from the banks. And then so I would say to you that we do not engage in, we invest in a lot of education awareness, but I would say the contribution of that employee sector for some of the jobs that they are doing today is highly valued and respected and paid for performance and is measured appropriately. So I think it's something, and in fact, through the pandemic, we leaned heavily on our retiree population to come back in when we had issues in India and so on. From a production perspective, we leaned on former employees and retired employees to help us get back into and up and running as an essential financial service company. So I think that there really isn't a place in our company, and I would encourage people who can make that difference to lead that way. And you know, in many ways, what gets measured gets done, and I think that's the way we look at it from all employees.
Thanks. Yeah, thanks very much. Look, every organization that I'm involved with, I think, does a reasonable job of understanding the importance of you know, the value of older employees, but every one of them could you know, do better. Goes back to the earlier point of trying to get the greatest value and not treating everybody, you know, the same. You know, you have to look at what people's different skill sets are. And as I was saying earlier, and I don't want to generalize, but you know, typically the older employees that I work with, you know, have more experience. They have better understanding, as I mentioned earlier. They understand your organization. They've usually worked at more than one organization, and you know, I think that all of them need to figure out how to better make use of the talents that older employees bring to the table, and don't measure, you know, a 65-year-old against a 30-year-old. They both bring very different skill sets to the table, and I think we need to take advantage of everyone's skill set during, you know, the cycle of aging, and everyone brings something different at a different point.
Excellent. Thank you very much. So I'd like to end this discussion today by looking at the future. To all the panelists, we'll go in the order that we started off with: Samir, Mitch, Jameli, Dolores. If you can give us one statement that gets to the heart of your perspective on the future of generosity and addressing ageism. Samir?
You know, I always like to say that everyone's like, why are you so interested in aging? Well, we're all aging, number one, and one day it could be us. And I think, you know, Jameli had a nice line about like, what's my destination? Where do I want to end up? Well, I'm looking forward to aging successfully, but I know that takes a lot of effort from all parts. So I think this is where, from an aspect of generosity in that we all have a selfish motivation to do this, but this is a good thing. And what benefits others will benefit us and all of us as a society.
Thank you. Mitch?
I want to advocate that, Samir. It's like, you know, we're all aging. And I like to say, if we're not doing that, the alternative is not so good. So I think that's important to recognize. The one thing I think it's very important is to really understand, you know, how important older employees and seniors are in our society. One of the things that the NIA focused on heavily when at the beginning was you know, making sure that younger people understood financial literacy. And I think we did a great job with other organizations out there in convincing various governments to implement that into the curriculum of their schools at an earlier age. I mean, high schools had it in many jurisdictions, but now we've pushed it down. The corollary of that is understand the importance of aging. And I like to call it the art of aging, because it is an art. We all get better, more knowledgeable, have more opportunity, but young people need to understand the value of aging smartly, you know? And I think that needs to start at a much younger age, just so people understand the life cycle and how their life could be better, but also how to take advantage of seniors. I mean, Dolores, you hit the nail on the head there, which there's a lot of abuse that goes on out there surely because there's a lack of knowledge. It's not the only reason, but it's amazing if you look at the percentage out there of neglect and not understanding. And so having younger people, and I don't mean, 50-year-olds, I mean, having, 10-year-olds and 12-year-olds working with their parents to help their grandparents, lots of opportunity there. And I think the best place to get that going would be in our school system. So, I'm a big advocate of that. And I think that's the corollary to understanding financial literacy, is to understand the importance of looking at the life cycle from beginning to end.
Thank you. Shameli?
Yeah, I think just to build a little bit on Mitch, I think it's awareness, right? I mean, we have an opportunity to be aware of this, to treat it a bit as an education, because again, I see this as a sort of a natural human dynamics, aging, and as you well put it, if you aren't aging, you're dead, and that's probably not a good destination. So I think that aging is real, and it should be, a bit in my mind, it should be a good place to be, right? We should set it up. We have earned a right for it to be a good place to be, especially in a well sophisticated society as we live in Canada, which by the way is a great country to be. So I see that one is awareness, education, and action. I think that's more than ever. And if there was ever an opportunity to get it, it's now through this pandemic, where we had a tragedy in our hands. And we need to learn from that and build the infrastructure and the right policies and the right destination for us to be respectful of that end that is coming, and for it to be someplace that we want to be, because we've earned that right. To me, that's how I look at it, and would encourage all of us. I'm actually quite optimistic, because we have the time to do it. We have the resources. There is enough giving, and there is enough government. The government needs to step up a bit more, for-profit, non-profit, but also the citizens and people need to get engaged with getting to us to a better place. So I'm optimistic on this, and I'll try to certainly to do my piece of it.
Great. Final word to you, Dolores.
Well, as the UN says, ageism is a global problem, no matter where you are in the world. So the way I see it is, if you acknowledge that you are going to get old one day, then you can get off that wheel and start to treat the elderly with respect and dignity, because your children are seeing what you do to mom and dad, and they will do the same to you, because what goes around comes around. And so I think that whether we have our grandchildren who sees you, or the aunt or uncle or whatever family member, they will remember. And when we are treating our elderly in a not dignified way, we have to remember that they too have memories, and they're not all in Alzheimer's stage or dementia stage, and they hurt. And sometimes they feel that they have nowhere to turn and just would prefer to die, because they can't believe that their own children are treating them that way. And one example I remember, this lady who had 8 children, and she had one son who was her favorite, who died young. And the other 7 children seems to forget that they had a mother that they could care for or pay attention to. And she would sit in her bed and she would say, only one, because she had one child that cared. It was the number 6 one that cared about her. And maybe because that person was in healthcare, they cared. But she says only one out of all her children. But all they wanted was what was in the will. So I think, we have to be careful what we wish for.
Excellent. And on that note, I want to thank the panel, Samir, Mitch, Shameli, Dolores, for being a part of this important discussion. I think it was really informative. And I couldn't think of a better way to kick off season 2 of Generous Futures. And a huge thank you to our lead sponsor of the Generous Futures panel series, TD Bank Group. Your leadership is truly commendable. Thank you as well to our promotional partners, the Association of Fundraising Professionals, Greater Toronto Chapter, Canadian Association of Gift Planners, Canada Helps, Imagine Canada, and Community Foundations of Canada. And thank you to our audience for joining us today. Please look out for an email in your inbox in the coming days with a link to a recording of this discussion, and please do share it with your network. We hope that you'll join us on November 9th for the next Generous Futures panel discussion called Combating Islamophobia. Details about this event will accompany the recording you receive in your inbox. Thank you again, and take care, everyone.